The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy, a local Health Mart pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Studio Arts and Glass, for sponsoring today's program, and of course, our technical producer, J.D. DeAngelis. In the studio with me is Brad White, a compounding pharmacist, and our very special guest, Dr. Sabrina Shilad from Altman Hospital Cancer Care Center. Good morning and welcome, Doctor.
Great. Thank you so much for having me. Good morning.
We'd like to remind our listeners today that our program is available on our podcast, which can be downloaded from the App Store on your favorite mobile phone. You can look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime. If you have questions you'd like addressed today, you can post them up on our live Facebook feed, or you can give us a call here at the radio station at 330-450-1480.
So, Doctor, tell us a little bit about your background, yourself, and what you do.
So I'm a Northeast Ohio girl. I grew up in Mentor, on the east side of Cleveland. And so after, preliminary schools there, I went down to East Tennessee, and I did all my medical school and training in East Tennessee. And then we moved back to Ohio in 2010. At that point, I was a general surgeon, had been a general surgeon at Altman since 2010. I had been there for several years, doing a little bit of everything, taking out gallbladders, fixing hernias, taking care of some women with breast cancer.
You mean the gallbladder with the great big scar, or the gallbladder with... Because I have one of those big scars.
Mostly it's with the small poke holes, but there are a few people with the great big scar that I helped contribute to.
Oh, gosh.
Sometimes we got to do what we got to do to get that gallbladder out safely. But there ended up being a need for a breast surgeon. The breast surgeon at Altman Hospital left in 2013. And at that point, there was a really big need in the community for someone to focus on women with breast cancer.
Now, you just didn't jump into that process. You would have had to gone for more training, correct?
Correct. So initially I sort of took over the breast program when the old breast surgeon left, but I needed more training, so that's exactly what I did. So I went up to the Cleveland Clinic. I was at the Cleveland Clinic from the summer of 2017 to the summer of 2018. I spent a year up there getting that extra training, specializing in women with breast cancer.
Wow. That's a real tough one. I just, I can't imagine a lady coming to you and has real big issues, and it appears to be there's so much breast cancer out there.
There is. So about 1 in 8 women get breast cancer now, and that's without any kind of family history. So, and breast cancer, it doesn't care about your religion, it doesn't care about what you do. The biggest risk factor that women have for developing breast cancer is being a woman, unfortunately. And that's a lot of what we see is women without any family history who go in, they get a mammogram, and it shows something that shows up as abnormal.
Diet? Fatty diet?
So we know that eating a well-rounded diet is one of the better things that you can do. A lot of times we talk about what we call the Mediterranean diet, which is low in red meat, high in, your fishes with omega-3 fatty acids, olives, olive oil, nuts, fresh fruit and vegetables.
What's our statistics on those people? Much lower?
It is lower. So we try to recommend good, healthy eating.
Any environmental impacts that's been studied? So you say it's not really family history.
Yeah. Well,
diet impacts, but what about what we're exposed to in this world?
Well, so family history is something that is important, but it's not the only thing. So as far as the environment and things that we're exposed to, it's the big things are smoking and alcohol. They seem to be tied to just about everything nowadays, but it is smoking alcohol. There is a correlation between that and breast cancer.
What about, if you don't mind, can you help our listeners understand, you said you did a fellowship at Cleveland Clinic.
Correct.
What exactly is involved in a fellowship, if you don't mind? Because I always
Yeah.
think it's fascinating to hear about a physician's journey and their training experience.
So a fellowship is extra years of training after a residency. So a residency is your basic training after medical school to help become sort of what kind of doctor you want to be. And then a fellowship is additional years of training after that to help get more specialized training. So my year at the Cleveland Clinic, I spent time working with their breast surgeons. I spent time working with their plastic surgeons, so that way I could see what the plastic surgeons need to have sort of the best cosmetic results after breast surgery, but also so that I could use some of those tricks myself. But I also spent time with all of the other subspecialists who take care of women with breast cancer. So if you have breast cancer, there's a full team of people helping to take care of you. So you need a breast surgeon, you need a medical oncologist, so that is a cancer doctor specializing in the medical treatment of breast cancer. You need a radiation oncologist if you need radiation therapy. But there's also people behind the scenes that most of our patients don't know about. And those are the radiologists. So the radiologists are the people who are looking at those initial images. They're the people doing the biopsies. And then there's the pathologist, who's the team looking at the actual tissue. And they're the ones who are helping us make the diagnosis of, is this a breast cancer? Is it not a breast cancer? What kind of breast cancer is it? What are some of the characteristics of it? So there's a full team of people that go into treating patients who have breast cancer. And part of my year up there was I spent months at a time with each of these groups. So that way, not only do I know what the rest of the team is doing, but I can also then tell our patients, like, this is sort of what everyone else is doing and what to sort of expect. Now, I can't be a medical oncologist, and I don't know all the little specifics, nitty-gritty, but it's enough information so that our patients know, like, oh, with this kind of cancer, I am going to need chemotherapy, or I won't need chemotherapy, and this is what the treatments will be like.
So it takes a village.
It absolutely takes a village.
Well, it's interesting because I would guess it prepares you better to know what other teams need to do their job effectively also, because when you have a better understanding of what everyone does, it all helps you guys work together better, because communication is certainly key.
Correct. And one of the big things that we do at Altman Hospital is we have a weekly tumor board. And so all of these different groups, we get together once a week and we talk about all of the women who come to the hospital and are diagnosed with breast cancer. So that way everyone is on that same page and we're talking about all of our patients.
So my understanding is that the reconstructive surgery now has really advanced quite dramatically. I have a friend, not an elderly lady, but 50s, who had breast cancer, and she had reconstructive surgery, and she really was quite upbeat about it. But then all of a sudden, the daughter shows up with it.
Yeah.
So, I know there's some genetic issues, obviously, with cancer. Is there more so with breast cancer, or?
There is. So there are certain genetic, combinations that we are aware of. And so there are certain genes out there that we look for. So for women who have a strong family history of breast cancer, multiple relatives with breast cancer, we also are looking for women who have ovarian cancer, because there is a connection between breast cancer and ovarian cancer. And so we're trying to see if we can find these women who are at higher risk because of their family history. Other things that we look at are certain kinds of breast cancer if you get them at a younger age. And in that situation, I mean younger as in less than 60. That sort of triggers a red flag of we need to be thinking if there's a genetic component going on which made them get a certain kind of aggressive breast cancer less than 60, or even just our women who are less than 50 who are getting breast cancer. We look to see if they carry a gene which increase their risk of developing breast cancer.
I've been around a long time as a pharmacist, and years ago, the big thing was conjugated estrogens. We were clear up to 2.5 milligrams with a lot of people and that sort of thing. Any causative?
So one of the things that we always look at as a risk factor is years of estrogen exposure. So we're looking at when do women start having their cycles and how long they're having their cycles, and then if they're getting extra estrogens on top of that when they're postmenopausal. And so there's a lot of debate right now in those postmenopausal women who are getting added estrogens, because there's some data saying that, maybe we shouldn't be doing this, but then there's also some data saying, it's not as bad as we think it once was, but it's certainly something to talk to your doctor about.
The first oral contraceptives that came out were very, very potent. They were 10, 20 times more potent than what we're seeing today. Same situation, would you say?
With the
early ones, yeah.
Yeah, with the oral estrogens, I think a lot of the estrogen doses do seem to have gone down. And one of the things that we do encourage for at least our breast cancer patients is talking to the doctors about vaginal estrogens to see if that's something that we can do.
Okay. I suppose we should take our first break here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
We're having a New Year's toy special at the Half Off and Hot Buy store in Louisville. 40% off all toys. This includes toys of all ages, stuffed animals, toddler sets, Legos, Star Wars, and more. We must move our remaining toy inventory to make room for a new shipment. You'll also find all remaining Christmas decor is discounted an extra 50% off. Come visit us at the Half Off and Hot Buy store in Louisville for our toy sale and get the deals before they're gone. Follow us on Facebook and Instagram for pictures or visit halfoffhotbuy.com. Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're talking about breast health with Dr. Sabrina Shilad from Altman Hospital. Have a question? Post it on our live Facebook feed or give us a call at 330-450-1480. So, Doctor, does an individual need a referral to come to you?
No, absolutely not. If they have a strong family history, they feel a lump, they're worried about something, I mean, they can just call us. So that's 363-6281. They just call. We have So a great team there, and so they'll get you in to see me, whether it's for a lump, whether it's for a breast pain, or if you're just worried because you have a family history of breast cancer and you don't know if it's something that you need to be watched closely for.
Are there different types of breast cancer?
There are. So there's the two most common kinds of breast cancer that we see. The first kind is ductal. So I guess to understand ductal breast cancer, we have to talk a little bit about the breast. And so the breast is made up of three major things. One is the duct, so the part that would carry milk from the gland out to the nipple. The next part is the gland, the part that would have made milk. And the third part of the breast is usually the fatty tissue, and that's what gives the breast its size and shape. So ductal breast cancer grows from the duct, the part that would carry milk. And lobular breast cancer is the other kind of breast cancer. It grows from the gland of the breast, the part that would have made milk. Within that, there's different things that we look at. We look to see whether or not the breast cancer responds to the natural hormones in your body. So we call those estrogen or progesterone receptors to see if the tumor cells have these receptors. And then the other thing that we look at that our pathology department helps us with is to see if it has these markers called HER2/neu, which is another marker on breast cancer.
Say it again.
It's called HER2/neu, which is it's a marker on breast cancer. It's a receptor.
Okay.
Now, so what I always try to tell our patients is, so just looking at what I've said right there. So you have ductal breast cancer, you have lobular breast cancer, and you have all these different markers. So most women, your breast cancer is not going to be like your friend or your neighbor's breast cancer. There's so many different kinds of breast cancer.
So is one or the other easier to diagnose, or are they all about the same?
So usually the ductal breast cancers are a little easier to diagnose because of the way that the cells grow. So the ductal cancer cells, when they grow, they tend to clump together. When the lobular cancer cells grow, they tend to grow out like little fingers. And so because it's growing out as a little finger, it can be a little bit harder to diagnose.
Well, when you test for breast cancer, do you test for all three kinds?
Yes. So when a lady has an abnormal mammogram and it warrants a biopsy, then when the pathologist is looking at the cells underneath the microscope, then they can see, is it the ductal kind, is it the lobular kind? And then they do their special stains to help with seeing those other personality characteristics of the tumor.
So what if you have a patient who's diagnosed with breast cancer? What's the next move? Treatments?
So it depends on what kind of cancer it is, some of the markers. More times than not, the first step is surgery. When it comes to surgery, there's two major options that we look at. One is a lumpectomy. We call that breast conserving therapy. And the other is a mastectomy, where you have to remove the entire breast. Most women who have a lumpectomy need radiation treatments that go with it.
Okay, and years past, radiation treatments were, how am I going to say this?
Tough?
Well, too harsh, maybe. Okay, yeah. More burning, more whatever. Yeah. And I'm talking about, my mother had mouth and throat cancer and stuff like that, and they burned her badly, But this was maybe 30 years ago or 35 years ago. Okay, so where are we today?
So radiation treatments for the breast are significantly different than it was years ago. So most of the way that the beams come across now, so they sort of come tangentially across the breast. Okay. And so that way there's very minimal scatter or very few radiation rays that go to the heart and the lungs behind. Okay. And the biggest side effect that we hear from women is that it's like a bad sunburn, and by the end of their treatments, they just feel exhausted. But that slowly improves, so it's a much more of a local treatment.
And lower dose? Yes.
I'm not, I think so, but I'm not 100% on that, of the historical dose versus the current dose.
So as opposed to massive radiation on the whole breast, you're able to focus more so on the tumor location.
So most of the time, they do the whole breast, as well as focusing in on the tumor location. And so they want to treat the entire breast for most women. But in certain women, they do only treat I guess, a focused part of the breast.
Okay.
Hey, we've been talking about some different types of cancer and mammograms and some treatment options. Would you be kind enough to digress just a moment and recommend when a woman should get their first mammogram? Because yesterday we had a screening in the pharmacy, and I was stunned at how many people don't have a primary care physician, haven't been to the doctor in years. What's your best recommendation for a woman in her health care?
So we recommend that women get their first mammogram at the age of 40. And so it should be every year from 40 onward.
Okay, and I guess I feel like that seems like it's later than it maybe should be, but is that because that age is probably recommended based on how the cycles are beginning to change, maybe?
Well, what it's looking at is it's looking at sort of when women are most likely to develop a breast cancer. And so women are most likely to develop a breast cancer within their late 40s through their 50s. And that's sort of the highest peak of developing breast cancer.
What about breast self-exams?
So breast self-exams have gone through quite a bit of change the last few years. The American Cancer Society is now talking about what we call breast awareness, so sort of being aware of any changes that happen within your breast. And so most women that I've seen who have a breast cancer that they find at a young age, it's usually something that they feel. So it's usually the woman's in the shower, and as she's cleaning and lathering, she goes, "Oh, what's that little lump right there?" And then she calls her doctor, and then we address it further. And so just sort of being aware of subtle changes in your breast. So we're looking for lumps, changes in the skins, redness, nipple discharge, nipple retraction, any of those things we want to know about. And it's unlikely to be a cancer, especially in that young age, but we always want to make sure.
I guess I'm still stunned at how many people find out later than they maybe should that they have cancer. It seems like if you see a change or think something's wrong, call immediately, right? Don't wait.
Right.
Don't assume it's just overdoing it in the gym that week or something, right?
Yeah, absolutely.
So, okay. What about, you mentioned some treatments. How are we, it sounds like there's advancements in radiation. How about other treatment advances? What's our success rate in treating breast cancer?
So early stage breast cancer, so 98% of women do well with this. And so stage determines survival when it comes to breast cancer. And so to have the best survival, you want to have your breast cancer found at the earliest stage. The best way to find an early stage breast cancer is to get your mammogram every year. We know that once you can feel a breast cancer, it is I don't want to say a late stage, but it's not as early as it could be.
Is surgery always the first option?
Not always. So there are situations, depending on the type of cancer it is, if it's larger or if the lymph nodes are involved, sometimes we do chemotherapy first. But more times than not, we usually do surgery first. Now, when it comes to doing surgery first, again, you can do breast conserving therapy, or you can do a mastectomy. Now, women who choose to have a mastectomy, you have the option to have reconstruction. Now, with our reconstruction options, we work closely with our plastic surgeons. Most reconstruction options are with an expander and then eventually an implant. One of the nice things that I learned to do last year was a technique called a nipple-sparing mastectomy. And so for women who are good candidates, we can preserve the nipple and the areola, so that way when they have their reconstruction, they still have a nipple and an areola, and it's sort of one step closer to feeling more complete. It's never as good as the original, but a little bit more complete.
Interesting.
Okay. Bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
The warmer weather is here. Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacist can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
We're having a New Year's toy special at the Half Off and Out By store in Louisville. 40% off all toys. This includes toys of all ages, stuffed animals, toddler sets, Legos, Star Wars, and more. We must move our remaining toy inventory to make room for a new shipment. You'll also find all remaining Christmas decor is discounted an extra 50% off. Come visit us at the Half Off and Hot Buy store in Louisville for our toy sale and get the deals before they're gone. Follow us on Facebook and Instagram for pictures or visit halfoffhotbuy.com.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
When we hear the word pharmacy, we think prescriptions, right? Hi, Paul White for the Medicine Center Pharmacies in Stark and Tuscarawas counties, a locally owned Health Mart pharmacy. Of course we carry prescriptions, but our stores carry way more than that. We have a large selection of ostomy and diabetic supplies and compression socks. All of our pharmacies carry a variety of canes, walkers, bath seats, rollators, and commodes, all at super low prices. Our rollators are only $69.95. Call or stop by our local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today we're talking about breast health with Dr. Sabrina Shilad from Altman Hospital. We've got a lot more to cover this morning, so let's get back to the show.
Okay, doctor, before the break you were commenting on the impressive improvements in breast reconstruction and some features that are available to help maybe help women feel a little bit better about having that process, although I'm sure it's very emotional and challenging. And it's great that you've been able to have the training you do to keep it local so people can be here in Canton, Ohio and not have to travel elsewhere. So did you have any other comments that you wanted to expand on about reconstruction, because we were up against commercial break and we kind of maybe cut you off earlier than we should have. So
no, that's okay. So one of the other things that's great about the reconstruction is, so we do have the nipple-sparing mastectomies, and the other thing that I've been doing that's been different has been the women who are having the lumpectomy. So traditionally we remove the area of the cancer, and then these women have been left with a divot where their breast cancer used to be. So one of the things that I learned in Cleveland was how to sort of fill in that divot. So that was working with the plastic surgeons as well as with their breast surgeons of how to move around the breast tissue and fill in that divot so that way women don't have a big divot after their lumpectomy surgery. Now, we try to make it as much like the natural contour of the breast originally was. There's still usually a little bit of difference, but the big thing that we're trying to do is make sure that women don't have that big divot or those big breast changes that they used to see with lumpectomies.
Okay, very good.
What about, there was a big ruckus some time ago about breast cancer, breast enlargement, surgery. Silicone, I think, was the big thing, wasn't it?
Yes. So there's a certain type of textured silicone implant that there have been reported cases linked to a rare type of lymphoma. And so the conversation to have, I guess, if you have one of those, the textured implant, or some people call them a gummy bear implant, is to talk to your plastic surgeon about that and talk about the different, benefits of. There are some positives to having that kind of implant. The risk of getting this rare lymphoma is, of course, very rare. But if that's a concern, talk to your plastic surgeon and see if that's something that you need to have removed or replaced.
Well, my understanding is that they went to saline. Is that correct?
So there are some saline implants, but I guess the trend over the last several years was, I guess back in the day, there was the bad silicone implants.
Yeah.
And then a lot of people transitioned to the silicone. And then now we're swinging back towards silicone. But the silicone technology and the current silicone implants is very different than the silicone implants of 20, 30 years ago.
I see. I know they were using in Central American countries, and South America. I read an article about they were using industrial silicones, and it's,
oh dear.
And some of the women were just destroyed, killed them. But it's all quiet right now. It doesn't seem to be any ruckus anymore about the type of implants.
Right. A lot of the technology has changed in the silicone.
Okay.
What about recovery? What can a woman expect after having either? Maybe, I'm sure there's different types. So the floor is yours.
Most women who have a lumpectomy, usually they go home the same day. So it is same-day surgery. You come in the morning, you get to go home later on the same day. Most women with a mastectomy, whether or not they have reconstruction, only have to spend one night in the hospital, and then they go home the next day. One of the things that I've been doing for our ladies who have a mastectomy is putting in a long-acting local medication around where we do the surgery to help with the post-operative pain. Our goal is for them to take as little pain medication as possible. And most women honestly don't. They don't have much pain or discomfort with this. If they're taking anything, then it's usually not a significant amount, just for the first day or so, and then switching over to Tylenol or ibuprofen. Now, with both of the surgeries, both the lumpectomy as well as the mastectomy, something that we haven't talked about yet has been, one of the things we do is we want to make sure that this cancer hasn't spread. So in certain women, we're doing an extra special test to test the lymph nodes at the time of surgery. And so we check those lymph nodes, we look to see if there's any cancer cells in them. If there's a cancer cell in them, then if they're in a significant number of lymph nodes, then we go ahead and remove the rest of the lymph nodes in the armpit. Unfortunately, that's the historically women who have breast cancer, they used to have those big swollen arms, the lymphedema. It's much less common now, fortunately, because we're taking out less lymph nodes.
Okay, so you have cancer in one breast. Do you take out the lymph nodes on both sides?
Usually we want to just check the lymph nodes on that one side.
Okay.
And then one of the other things that I do that's a little bit different is for women who have to remove all the lymph nodes underneath the armpit. I do something to help identify the lymphatics that are draining the arm, so that way we can try to preserve them if possible, and again further decrease the risk of them getting that big swollen arm, that lymphedema.
I see. Wow. It's amazing. Absolutely amazing. Where are we at, Brad?
I guess I'm wondering, you're talking about some things that you just said that you do that are a little different to help prevent that swelling. What's on the horizon for breast cancer surgery and treatment and reconstruction? Is that a loaded question? Or?
It is somewhat of a loaded question. I was fortunate to be exposed to a lot of the things that are on the horizon last year, and I was actually, one of my big research projects when I was at the Cleveland Clinic was we actually developed this new technology looking at new ways. I shouldn't say we developed a new technology. We sort of developed a new technique to help look at lymph nodes. And so that was, I guess, a great experience of sort of new ways to help sort of treat and address lymph nodes in women who have had breast cancer that has spread to the lymph nodes and then who undergo treatment before surgery.
Neat. Okay. What about something else I was thinking about too? What about any other treatments that are now available to reduce risk? Like you've mentioned radiation and some oncology. Are there is there anything being done to support a patient who's higher risk, or is it just more active monitoring and supervision?
So there are different options for women who are high risk. Now, women can be high risk for a couple of different reasons. They can be high risk because they have a strong family history, and they could have a strong family history, and they could have a strong family history and carry what we call the breast cancer gene. And so if you're high risk for a genetic reason, then you have options for close screening and surveillance. Or close screening. So some women, that's a mammogram once a year. Some women, that's a mammogram and an MRI. And so that way we can watch women closely. Other options for women who are high risk because they've had a biopsy in the past that show atypical or strange cells. Now, sometimes those women are also high risk, and what we do for them is also we like to watch them closely. Sometimes mammogram and MRI. But sometimes those women are also eligible for something that we call chemoprevention. And that can be taking a pill to reduce the amount of free hormones in their body to lower the risk of them getting breast cancer down the road.
Okay.
One of the other big things that we always tell our women about is one of the best things you can do, before you get diagnosed with breast cancer to reduce your risk, or after you get diagnosed with breast cancer to help with survivorship, is actually exercise. So we know that women after they're diagnosed with breast cancer who exercise have better long-term survival.
So I guess that translates down to all the benefits from cardiovascular and weight
Correct.
management and things of that nature too. So
In the beginning, you told us a statistic on 1 in 8 women
Yes.
get breast cancer. Did I miss this, or did I just not catch it? What's the cure rate?
So most women with early stage breast cancer, so 98% of women don't have any further problems down the road.
Wow.
And that's with early stage 0, stage 1 breast cancer.
Okay, what about the age of the woman? If you discover cancer in like a 25-year-old, what's their term on this earth look like?
So it depends a lot on the kind of breast cancer they have and the kind of treatments that they get. Some 25-year-old women, they don't get an aggressive cancer. They just, for some bizarre reason, grew a not aggressive breast cancer at a young age. And so we treat it the way we would treat anyone else. Now, we want to make sure that there's not a genetic reason for that. Now, if they have a more aggressive kind of breast cancer, then sometimes they do get more aggressive treatments. But the treatment is usually not determined by their age. The treatment is determined by the kind of breast cancer that they have.
Okay. Men get breast cancer too.
Men do get breast cancer too. Yes, and we do see a couple of guys every year who develop breast cancer. The guys that we see who develop breast cancer, one of the first things we do is we set them up for genetic testing, because most men don't, and we want to see if they carry a gene that increased the risk of them developing breast cancer. So even guys, if there's a lump that you feel in your breast that's new, then get it checked out.
So it's uncommon, is what you were saying
It
here.
is uncommon, but it does happen.
Huh. Strange. Hormonal? No? Yes? With these guys?
Actually hormonal as well. And so we treat them the exact same way that we treat women.
Okay. Huh. Amazing.
I've been meaning to ask you the genetic testing question. So is it something you're only using in men when it appears, or is it more common for certain types of cancer or family history screening at this point in time?
So genetic testing is something that we look at the patient's family history and the type of cancer that they have. And again, usually the men, that's automatic genetic testing, but it's a lot of family history, age of diagnosis, what other cancers are in the family.
Okay, we have lymph nodes all over our body. Okay,
Yes.
as I recall from
Yes.
college, whatever. You not only check the ones under the arm.
So we usually just check the ones under the arm when we're looking at and treating women with breast cancer.
But let's say the lymph nodes are just chock full of cancer. What's the next move? Would you check the others, or?
So we wouldn't. So at that point, we would check the rest of the body.
Okay.
Because the way breast cancer tends to spread is it would go from the breast to the lymph nodes, And then if it sort of breaks through the lymph nodes, then it has the potential to go anywhere else in the body.
I see.
And so those lymph nodes are very important. They're sort of our gatekeepers. And so if breast cancer leaves the breast, it usually goes to the lymph nodes first, and then it sort of gets stuck in the lymph nodes.
I see. Very interesting. Okay, final break is here. Listen to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
The Medicine Center Pharmacy makes remembering to take your medication easy. Our personalized dose packaging helps keep your medication organized. It's simple, and we package your medication based on when you should take it. So you can take your medication at various times throughout the day, you say? No problem. We can package your medication with the date and time, so all you have to do is tear off your packet and take it with you. Now you never have to wonder if you missed a dose or not. Let us help you keep yourself healthy at the Medicine Center Pharmacy and save money at the same time. We're located in Stark and Tuscarawas counties.
We're having a New Year's toy special at the Half Off and Out Buy store in Louisville. 40% off all toys. This includes toys of all ages, stuffed animals, toddler sets, Legos, Star Wars, and more. We must move our remaining toy inventory to make room for a new shipment. You'll also find all remaining Christmas decor is discounted an extra 50% off. Come visit us at the Half Off and Hot Buy store in Louisville for our toy sale and get the deals before they're gone. Follow us on Facebook and Instagram for pictures or visit halfoffhotbuy.com. Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're discussing breast health with Dr. Sabrina Shilad from Altman Hospital. Last segment of the show is here.
Okay, at the break we were talking about patients that we both talk to on a weekly basis that don't have a primary care physician and maybe have never been screened for breast cancer. And I hear at Altman you have an option.
Yes, we do. So one of the things that I love being part of is we have an annual cancer screening day. And so we have grant money that helps cover mammograms. And so if you feel a lump or you just need a mammogram, you can sign up ahead of time and come in and get a free mammogram. One of the most heartbreaking things that I always hear is women who, they're like, oh yeah, I felt a lump, but I didn't have insurance. And they just feel these lumps grow and grow. And it's heartbreaking because I mean, they know that something's wrong, but they can't. They don't know that there's resources available. So there are plenty of resources available. So we have Cancer Screening Day. When we don't have Cancer Screening Day, we have an excellent nurse navigator in the breast center, and there's funds available through grants that they've acquired, so that way if a woman comes in, she can at least get a mammogram, and we can go from there.
So moral of the story is ask questions, and there's hopefully possibilities that can help you.
Yes,
So
absolutely.
Don't write that off because you're not able to have insurance maybe right at this time.
You think
Right.
part of that's fear, though, that you're going to...
Part of it is fear. Part of it is that denial of maybe this lump will go away.
Sure.
We see, unfortunately, a good number of women who they know that something's wrong, but they're just
I'll
scared
wait it
to
out.
real.
Huh?
Yeah.
Huh.
We had another question at the break from a caller about lymphedema, and do you care to address that question?
Right. So, lymphedema is a potential, complication or side effect from lymph node surgery. So it's usually related to the lymph node surgery. So nowadays we just sample a few lymph nodes. That's usually the plan. So taking out somewhere between 1 and 5 lymph nodes. I guess the average is about 3. And when we take out just a few lymph nodes, the chance of having lymphedema is quite low, only about 2 to 4%. But sometimes we do still have to take out a good number of lymph nodes underneath the arm and the armpit. And so when we do that, the chance of lymphedema goes up significantly. Some numbers say 8 to 10% of the time, other numbers say as high as 20% of the time. And so getting that lymphedema of the arm, it can happen with a lumpectomy, it can happen with a mastectomy. The big part of it is the lymph node surgery. And so when you do that lymph node surgery, it does potentially open you up for lymphedema, that swelling of the arm. So women who get lymphedema, the swelling of the arm, we sent them up to see there's a dedicated lymphedema therapist at the hospital, and they work on compression therapy and stockings to help treat that.
So, how many lymph nodes do we have under our arm?
So anywhere from 12 to 50.
Oh, gee,
so
no kidding.
There's a whole bunch. And
All
they're
in this area.
right.
Guess I better get my book out and take a look.
Yeah. So there's
Jeez, I had no idea.
yeah. So and a lot of it just depends on your size and your individual person. Some people don't have a lot of lymph nodes there. Some people have a bunch. So everyone's a little bit different.
Huh. Amazing is that.
How about in the beginning of the program you mentioned that you do not need a referral to come see
Correct.
you or talk to someone at the Cancer Center at Altman.
Right.
Can you hit the listeners with your phone number again or the website?
So it's 363-6281, and so that's my office. And you can call with any breast problems, concerns, lumps, bumps. I mean, any of those things that if you're worried about your breast, then it's not necessarily women who have cancer. So I certainly see women who don't have breast cancer. I see lots of women with breast pains, breast lumps, bumps, other things that are going on. And a lot of women we see are simply high risk, strong family history of breast cancer, and they're worried. They want to make sure that they're doing everything in their power so that if they do develop a breast cancer, we find it early, or things that we can do to reduce the risk of getting breast cancer.
Can you touch on what would make you high risk?
So family history, and it can be on your mom or your dad's side. So if your mom and her entire family is cancer free, but your dad, it seems like every woman on that side of the family has had breast cancer, like don't think that just because it came from my dad it can't come to me. So both sides of the family. We usually look at first degree relatives and then second degree relatives. But if there's not a lot of women in your family, but it's still a significant pattern, then we want to know about it. So family history is one of the biggest things. And then the other thing is if you've had a biopsy before in the past that show those strange or abnormal cells, that can be a marker for being high risk. And so it's worth asking your doctor about.
Can you touch on the date if there's one fixed on the breast cancer screening at the hospital?
Oh, I do not
You
know.
do not know.
I don't know off the top of my head.
And that's
I'm sorry.
annual, did you say?
It is annual. Yes, it's usually in April.
Okay. And that would be a complete breast exam. Is that what we're saying here? A scan?
Yep. So it's a full cancer screening day, and so you can have breast screenings. So it's usually an exam and a mammogram. You can have cervical screening, pap smears, skin screenings, prostate screening. So they screen, I guess, most organ systems.
Wow, fabulous. Okay, we're just about out of time here. It was a good show. Very interesting. Thank you very much. Our special guest, Dr. Sabrina Shilad from Altman Hospital Cancer Center. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. And if you don't have a healthcare provider, you should get one. Thanks to Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis. As always, we thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. We are a local Health Mart pharmacy caring for you and about you. Have a healthy week, and we'll see you right here next Friday at 9 a.m. on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.